stroke is unexpected, like a bolt out of the blue, and they don't just happen to older people. Young adults are increasingly at risk as well.
I had a stroke at 38 years old. I was active, I ate healthy, and I didn't smoke. One of my best friends was getting married, so I flew into Boston and I drove another 2.5 hours to the venue. The morning of the wedding, I ran 8 miles and I felt fantastic. We celebrated until 4 a.m. and when I crawled into bed, I felt that strange sensation like you're going to sneeze, and then everything went black. I'd had an ischemic stroke.
911, what's the address of emergency?
A blood clot had cut off the blood supply to a portion of my brain. My doctors also discovered that I was born with a tiny hole in the wall between the top 2 chambers of my heart. This possibly allowed a blood clot that I didn't know had formed in my leg or my pelvis to rocket through my heart directly into my brain.
Merideth joins us, and I know you've had quite a year, so thanks so much for being with us.
Thank you
and
for having
also
me.
joining us is our good friend and colleague, Dr. Freda Lewis-Hall, who is the Chief Medical Officer of Pfizer. Welcome back.
Thank you. Always great to be here. You know, Meredith's story is dramatic, but it really isn't all that uncommon. Up to 14% of ischemic strokes occur in people 18 to 45 years of age. And here's the problem. Young people don't think of themselves as at risk for stroke, which is really a problem. And on top of that, they don't know what the symptoms of a stroke are, so they don't know how to get help soon.
And that's why we do shows like this,
That's
because
exactly
stroke
right.
can happen at any age, and it's really important to recognize when a stroke is happening so you can seek help right away. You have to act fast, and you can actually use that acronym to remember the symptoms of a stroke.
Absolutely. So F is for face. Ask the person to smile and see if one part of their face is drooping. A is for arm. Ask them to raise both arms, see if one arm is weak. S is for speech. Have them repeat a very simple sentence, but check to see if their speech is slurred or they seem confused. And T is for time, which is of the essence. Tell people dial 911. Stroke is a medical emergency. The longer your blood flow to your brain is interrupted, the more the damage.
And the good news is that the younger your brain, the better chances you're gonna have a full or nearly full recovery. But a stroke, we know, could be a truly life-changing event. Meredith, clearly it has been for you. What was your experience like?
Well, when I had my stroke, I couldn't move the left side of my body. And, you know, not being able to tie my shoe, putting my hair in a ponytail, it was just really terrifying.
In Meredith's case, venous thromboembolism, or VT, may have been a contributing factor to her stroke. This occurs when a blood clot forms in a vein, often in the lower extremities. It can break loose. When that happens, it can travel to the lungs, and then in some unique cases, like Meredith's, even to the brain.
And VTEs are just one type of risk for stroke, so there are a lot of other risks. For example, having a history of cardiovascular disease is a risk. Having a family history of stroke. Having diabetes, being obese, those are risks. In addition, irregular heartbeats raise your risk of stroke, as well as having high blood pressure and high cholesterol, so you have to know your numbers. You should also consult with your physician because some medications actually increase the risk of stroke. And of course, excessive alcohol or the use of tobacco and certain illicit drugs like cocaine increase the risk of stroke. And so, Meredith, I really want to ask you, you've made such remarkable progress.
Thank you.
What do you attribute that to?
A whole lot of hard work. But really, I call it my peace. Physical therapy, a whole lot of patience and positivity. And eventually I was able to do some indoor rock climbing with my 10-year-old son, Colin.
Very cool.
But it was unique because it was different therapy. I may force my left arm to really get up that wall and kind of those neurons to find new pathways. And the big news is that I have decided to run the New York City Marathon on the 1-year anniversary of my stroke.
Proof that a stroke doesn't have to end your life.
That's exactly right. Physical rehabilitation has really made great strides. About a third of patients who have strokes actually make a full recovery or have minor residual or permanent damage as a result of that. The key is know your risks because you can dramatically reduce your risk for stroke, and know the symptoms of a stroke because getting help early is really the key. So for more information on strokes and on VTEs, you can go to gethealthystayhealthy.com.
Thank you. And Meredith, thank you. Good luck in the marathon. We can't wait to hear how it goes. We'll be right back.